Hi guys, today for my informative speech I'm going to be talking about CNAs, which is a Certified Nursing Assistant, and how to become one. This class is a 75-hour CNA course. It's usually held at any local community college, or it is held in high school. By taking it in high school, I think that would be the better route because it's free. Taking it through a college independently runs you about $500. This includes obviously the class, the clinicals at the end, and also the state testing at the end, which is a written part and a skills part. Um, when I took my CNA class, this is about in 2011, the class would be held every Tuesday and Thursday nights from 5 to 8 p.m. The first couple of classes, we would just listen to the instructor and take down notes and, get used to the class and what it's about and everything like that. Then we started having quizzes. These were once a week, so we would review the night before, and then the next night we would have the quiz. To pass the class, you actually have to pass with at least an 80% in the class to even go to clinical. So you want to make sure you study, 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 and pass all those quizzes, or at least most of them. We would also start practicing on dummies. This would get us prepared for state testing at the end and also clinicals at the end. Um, we would just get different situations, get split up in groups, and try to see what we know already and get used to everything. The few last weeks before state testing, we would go to a nursing home for clinicals. Um, Without attending them, I don't see you passing the class because this really gets you prepared for the skills testing at the end. And we would just go to a nursing home and work with different CNAs, and we would get to actually practice on the elderly people. Um, get different situations, not knowing what we have to do, and see what we can do, and just get used to everything. So we'd really be prepared for when we get a job, and like I said, for state testing at the end. When state testing came around, we would get split up into two groups. There was a skills part and a written part. The written test consisted of 100 words, and the skills testing we would get we would practice on a state tester, and basically we didn't know what we were getting ourselves into, so we didn't know, coming in what skill we would have to do. It could be anywhere from hand washing to taking vitals on somebody to doing pericare. It could be anything we didn't know. So that's why I said going to clinicals is very important. Um, these tests you had to each pass at least with a 70%. If not, you would have to wait until the next month and retake it. You wouldn't have to retake the whole class, just state testing. You actually don't even have to take the class or clinicals to actually get your CNA license and take state testing, but it gets you really prepared. So I'd advise you to actually get the class done. And if you would pass the class, your certificate came in the mail, and it did take a few weeks to do. So if you did want to go find a job the next day, for instance, you still could, because we would be put on a registry, so employers would know that we are a CNA. The different job duties for CNAs are personal hygiene by, giving them bedpans, urinals, baths, back rubs, shampooing their hair, shaving, assisting with travel to the bathroom, and helping them with showers and baths. We would provide with daily activities by assisting with serving meals, feeding the patients, ambulating, turning, repositioning, providing fresh water and snacks. We would also provide adjunctive care by administering enemas, douches, non-sterile dressings, surgical preps, ice packs, heat treatments, sits, and therapeutic baths. We would maintain patient stability by checking vital signs and weight, testing urine. We would provide patients comfort by utilizing resources and materials, transporting patients, and answering call lights is a big one. It can get really busy, especially after supper. We would document actions by completing forms, reports, and logs. In the nursing homes I've worked at, there are always kiosks. Every time you touch a patient, you would have to chart that at the exact time. So you really want to make sure you're kind of quick, because call lights do get very hectic. And like I said, you need to document everything on the kiosk. We would maintain work operations by following policies and procedures. We would protect organizations by keeping patient information confidential, which is a huge one. You don't want to give out names. You can give out what happened that night, but you don't want to give out any names. Everything's got to be totally confidential. The different skills and qualifications were multitasking, medical teamwork, bedside manner, infection control, creating a safe, effective environment. The different salaries for Dubuque, Iowa are anywhere ranging from 21,000 to 30,000 a year. Um, and the more experience you have as a CNA, the more you start off at. So if I was someone coming in the field making um, a different from somebody else, it's really because I have more experience than the other person. And then my two references are hiring.monster.com and www.one.salary.com. And that is my informative speech. Thank you.